Well, it's that time of the year again. Are you ready to do battle with those pesky mosquitoes?
Oh, they can take a real toll on your skin, can't they? There are some things, though, to consider as you spend time outdoors.
Yep, dermatologist Dr. Sherry Ingraham shares some advice with you and our own Rita Garcia.
So with the warmer weather in full effect, obviously mosquitoes can be pretty unbearable. So how can we protect ourselves and our body?
You want to remember to cover with both spray products as well as clothing. And the key is to find the product that's appropriate for your age and for what you're doing that day.
So are there some parts of the body that are more prone to these mosquitoes?
Absolutely. So the parts of the body that are more prone are what you would think, your arms and your legs, parts that are typically uncovered.
Talk to us about some of the mistakes that we make. You know, I like to wear a lot of perfume, and sometimes I find the mosquitoes like me more than they like anyone else.
They love a good sweet fragrance, so you want to avoid perfume. Studies have also shown that ingesting certain chemicals, garlic, though you don't want to smell like garlic, can help thin them off. Also, one study showed taking vitamin B1, which is thiamine, in a dose of about 75 to 150 milligrams a day could be helpful. You want to wear light-colored clothes. They like dark-colored clothes, so wear light-colored clothes and stay as docile as possible. The more you run around and put off CO2, the more they're attracted to you.
You know, can certain products also attract them, like, for example, the moisturizers or maybe the sunblock that we put on?
If they're scented. So I would never tell someone not to wear sunblock. Sunblock tends to not be scented, but you brought up a good point, which is you don't want to use combination sunscreen products with these products because you'll absorb too much of the chemical. For example, the DEET. You want to put your sunscreen on first, wait a few minutes, then apply your insect repellent.
Okay, here's the other thing you wanted to mention this morning. Resist the itch. This is tough.
It is tough. We all want to scratch a bug bite, but what happens when you do that is you can introduce not only skin bacteria, but other harmful bacteria into the wound, as well as increase the chance of swelling. So what I tell parents and patients is, first sign of a bug bite, you can put a little over-the-counter hydrocortisone or Cordate on it. If you have a lot of bug bites, you may want to go ahead and take some oral Benadryl.
Okay, so how can we protect our kiddos? Because with the summer months, you know, upon us, they're all going to be outside rolling around in the grass.
Right. Good rule of thumb, less than 6 months old, no DEET. Okay? From 6 months on, you can use DEET. However, some of the newer chemicals, like in the Cutter Advanced Picaridin, great chemical to prevent, not as difficult on the skin as DEET can sometimes be. Over 3 years of age for the Picaridin, which is in the Cutter Advanced. Also, oil of lemon eucalyptus is a great new product, more of a natural product, again, only in people older than 3 years of age.
All right, Dr. Sherry Ingraham, I think you covered just about everything. As always, thanks for coming in.
Thank you for having me.